Good afternoon. My name is Wally Curran. I'm the Executive Director of the Winship Cancer Institute of Emory University here in Atlanta, Georgia. Mesothelioma is a very complicated and hopefully in the next few decades, less commonly seen malignancy. It appears to arise in the lining of the lung, which is really a very complex anatomic surface that really kind of weaves around each of the five lobes in the left and right lung totally. So it can appear in an upper part of the chest, lower part of the chest, right or left. The preferred treatment for mesothelioma, if it's small and localized, would be surgical removal. Unfortunately, many times mesothelioma is diagnosed at a later stage, and in a later stage, surgical removal, it may not be possible. So there's a couple of different surgical approaches. One of them is sometimes referred to as an extrapleural pneumonectomy, where the entire lining of the lung is removed, as well as the entire lung. And that's a particularly challenging surgery for any patient, and particularly if the patient happens to be on the older side and has a variety of medical conditions or what we call comorbidities. There are some surgeons who, with expertise in mesothelioma, who approach some such patients with a less radical approach that involves partial pleurectomy or removal of the lining and some type of removal that may be less than the entire lung or less than a pneumonectomy. Radiation is sometimes used, particularly in that sort of case, particularly if there's a concern that some tumor has been left behind. So radiation can be used when surgery is not possible, particularly if there's pain or growth associated with it. But it's a fairly technically demanding process to try to treat the lining of a lung without causing too high a dose to the lung. The Energy Oncology group, which I serve as a group chairman of, recently opened a national trial where patients will be randomized between receiving radiation after optimized surgery or not receiving it. So that will be open at centers around the United States and Canada and beyond over the next several months, and will probably run for several years. In the meantime, very significant advances in defining targets, particularly in a moving part of the body, because all of us move our lungs many times a minute in order to breathe. So to treat a moving structure like the lining of the lung can be quite challenging.